Welcome to another episode of Synergy Speaks. I'm Bushra. Today I'm joined again by Matt Vrhovac. Matt is the guided surgery and chairside specialist here at NavaGation Precision Guidance. So last time we talked a little bit about chairside and the importance of having a chairside specialist for their first Synergy case. My first question for you is, I wanted to dive a little bit deeper today about chairside. What are the common and main challenges you face daily while being at these chairside surgeries?
Bushra, probably the biggest thing is accessibility during the surgeries and being able to get all the componentry in. Even with our guided system having a small footprint, one of the hardest things is trying to get the tooth aligners, the foundations, everything in the mouth. And one of the biggest tricks that I've found is once you get everything in is to simply close the patient down into occlusion. And then what that will do is free up the lip space, the vestibule and everything to allow the lips to relax, and so that we can actually get the rest of the componentry in and hardware.
That's a pretty useful tool. Here's something I'm sure you'll always get asked during surgery, and I definitely personally see myself in surgeries. So surgery went well. After a couple of hours, you picked up the provisional, it's screwed in. Now it's time to check the bite. The doctor notices the bite is off. What would the first advice or tip you would give the doctor then?
If the bite's off, the first thing I would probably usually tell people not to do is panic.
Yeah.
One of the biggest misconceptions with surgeries is when the bite's off, what happened? And usually what that is, it's not a mounting issue. It's nothing that the doctor necessarily did wrong. It's usually just simply due to the patient's bite. And what I mean to say is the patient slipped into centric relation as opposed to centric occlusion. When that happens, usually what we'll do is allow the patient to go for a couple of days, let them walk, come back, have them back a couple of days later, adjust the bite if needed, but usually what we'll find is that the TM joint will actually relax, the muscles will relax and allow the bite to come back into position.
Makes perfect sense. So finally, with so many materials available in the market, what are the best pickup materials you would recommend for doctors to use if they're going to have their staff do the chairside pickup?
That's a great question. There's a lot of materials on the market, like you said, and they all work. My two favorite materials are going to be Stellar and Vrhovac.
Yeah.
Traditionally, that's what I've used for a number of years now. Stellar is still my #1 go-to whenever I'm going chairside. But ultimately, my biggest answer is going to be use what works for you.
Yeah. Well, thanks again, Matt, for joining me on this week's episode of Synergy Speaks. If the doctors have any chairside questions for you, how can they reach you?
They can give me a call at 1-844-NAVAGAT. Any of our chairside specialists would be happy to assist.
Awesome. Well, thanks again, Matt. And remember, it's not just the surgery, it's a smile synergy.